Good morning. You're very most welcome, our viewers of Manuel's channel. Yes, we thank you very much for supporting us, and we thank you for viewing and commenting and sharing and subscribing. Thank you very much. Thank you very much. Well, today we are going to look at gastroenteritis. What is gastroenteritis? What causes gastroenteritis? Right? And how do we prevent it? And how do we treat it? Right? What are the signs of gastroenteritis? Okay? 5. Gastroenteritis, just from the definition of the name gastro and then enteritis. Gastro is the stomach and its tract, okay, the intestines. Right? So enteritis, enteric or enteri is a Latin word meaning intestine, enteri, and gastro is abdomen or the stomach. So gastroenteritis or gastroenteri. Gastroenteri is gastro, the stomach, and enteri, the intestine. So, and the word enteritis or tis at the end means inflammation. Okay, so gastroenteritis is the inflammation of the gut or the GIT, right? And like in any other occasion where there is inflammation, we always feel pain, right? So in gastroenteritis, one of the prominent signs or what happens is we get bacterial attack onto the gut, and these infections will cause inflammation of the GIT, right? And as it causes the inflammation of the GIT, it has other effects that comes along with it, right? And these effects will cause some signs and symptoms that we shall see. Okay, so gastroenteritis is a bacterial infection. Gastroenteritis affects both adults and it affects as well children. And gastroenteritis has signs like 1, there is pain of the GIT, right? And then 2, there is at times loose stool, right? Then due to it being a bacterial cause or a bacterial effect, it at times brings vomiting and fever, right? So in gastroenteritis, we shall have vomiting, we have abdominal pain, we have abdominal grumbling, we have diarrhea, we have fever, we have loss of appetite, right? So all these are signs of the gastroenteritis, right? Yes. Gastroenteritis is one of the disease that is diagnosed depending on the signs and presentation or the signs and symptoms. What a client will tell you, what a patient will tell you drives to a diagnosis of gastroenteritis. Though in some cases, gastroenteritis is diagnosed at times after someone may be doing a typhoid test and is negative. Then you can reach that diagnosis of gastroenteritis. And why? Why would he do a typhoid test maybe? Basically because gastroenteritis just like typhoid, they do have same signs. Most 90% of the signs are the same. So that's why at times we may require to do a typhoid test. That's widow. At times we may require to do a widow test to rule out a bacterial typhoid from a gastroenteritis, right? So we do not do a widow test as a confirmatory test for gastroenteritis, but we do a widow test just because we want to do it to rule out typhoid and then diagnose gastroenteritis fully, right? Yes. So, like we've said, that there is acute abdominal pain, right, in gastroenteritis. Then there is diarrhea, loose stool, and at times the loose stool or the loose motion might be more frequent than usual, right? So gastroenteritis in children, you'll find a kid or a child cuddling. When I talk of cuddling, it means lying on the abdomen, right? He lies on the abdomen, and times, it feels like he's bending over, because of the too much pain in the stomach. At times, makes the child to present that way, okay? Then, in extreme cases, gastroenteritis can also bring into some bloody stool, right? Yeah, because if it's too much, it will bring that. But if it's not too much, you will just have loose stool. At times you can pass stool which is mucoid, mucoid and watery mucoid, right? Yeah, as well. At times the stool we pass depends on what you ate, right? But it will have that mucus kind of, yes. So it will present as well with fever, you feel the body is feverish, there is no appetite, you may vomit, yeah. And at times not all these signs are present, but some people have all and some will have a few of the signs, right? Yeah, simply because the body is affected in different ways and your defense mechanism differs from mine, differs from hers, differs from everybody else. So the rate of defense mechanism will be different, okay? So our viewers, at times when you feel these signs, okay, when you feel these signs, say that somebody is having that diarrhea, okay, you're feeling abdominal pain, okay, you have say headache at times, don't panic, right? Relax, but don't relax and sleep. No, relax in a way that when you go to a hospital, note this: even if you are in too much pain, my dear listeners and watchers of this channel, if you have too much pain and you reach a hospital, tell the medic, I feel pain. Be calm, right? Don't cuddle so much like the kid. At times in other medical clinics that you walk to, they will charge you according to the presentation. So when you present to them that you're badly off, right? When you present to them that you're badly off, you will be overcharged. You will be even given unnecessary drugs, unnecessary treatment at times. Yes, so I was telling you that when you go to a hospital and you present with too much pain, right? You present to a medic that you're badly off, right? Other medics will charge you according to your presentation, right? So when you move into a hospital, try to be calm, right? Try to contain the pain and show them that you're not badly off, right? You'll be treated you'll recover, right? If you show them that you're badly off, they will overcharge you and they will give you unnecessary medications at times, right? Because when you have the pain, they'll give you some painkiller, they'll give you the antibiotic, and you'll be okay, right? So always, when you go to a hospital, try to hide the pain, right? Talk of pain, but don't over-exaggerate the pain. Don't overshow the pain. Because once you show, the moment you show that pain, other heartless medics will overcharge you for that. Alright? Take note of that. Alright. So, we continue with gastroenteritis. How do we treat antibiotics? How do we treat a gastroenteritis? Being a bacterial infection, we need antibiotics. Alright? And in this case, mostly, when we are talking about gastroenteritis, we have the great antibiotic of choice, okay? And this is metronidazole. Other people call it fragile, alright? You will need fragile, and you take, if you are an adult, you will need to take 1 gram in the morning or start, then the rest you will take 600 grams BD for 3 days, and gastroenteritis will be controlled. Alright? If you have pain, too much pain, Panadol can do for you, or ibuprofen can do for you. Panadol you will take depending on your age. An adult, Panadol dose is 1 gram TDS, or 3 times a day. That's after every 8 hours. Okay? Then, if you have ibuprofen, you can use ibuprofen. Ibuprofen we take 400 grams 8 hourly for an adult. Those are 2 tablets, depending. Though ibuprofen comes in 2 packs, we have a pack of 400 milligram, and we have a pack of 200 milligram. So a pack of 200 milligram, you will take 2. A pack of 400 milligram, you will take 1 8 hourly. Alright? So, if it is too much that you need an injectable, then that part also will be handled. Mostly, someone can prefer to give you safe. Fine, it can work, but Metro has the injectable form. Okay? Metro injectable form, an IV would be of great need. Alright? So, if we have that, we need to take those 2 antibiotics. The antibiotic of metronidazole. Then at times, on top of the metronidazole, we can add CAF or chloramphenicol. Chloramphenicol is a capsule form. For children, we have the syrups, right? Children, depending on the age, they can be given, right? 5 milligram, 5 mils, or 2.5 mils, So, 8 hourly. If an adult, you take 500, because each capsule of chloramphenicol is 250. So you can take 2 in the morning, 2 in the afternoon, and 2 in the evening, right? So where you are, if you feel the signs of headache, gastroenteritis, you have diarrhea, you have no appetite, yes, try to get this medication. In countries where you can walk over the counter and you buy the medicine, just go, tell them I need this, and then they will guide you with the prescription, and then you will take 2 days. If there is no change, or if you take in the morning and you take in the afternoon and you take in the evening and then you still feel the same, then you can proceed to the hospital and get different medication, but these two will work for you. Thank you for watching our channel, and we shall continue presenting to you more cases and more conditions. So continue sharing this, continue liking it, continue commenting. Manuel is with you. Thank you for watching, and bye bye.